It's another day with the physicians where your health is our business.
Growth spot the end. So you are not going to take some drastic measures. But a 10-year-old coming, pressure is high. But also to know that not only when your pressure is high that you have glaucoma.
Sugar, and I don't know about any other one, but what you know is
You're welcome back to the training of your regular program.
As the global COVID-19 pandemic spreads worldwide, new challenges are rising in the clinical landscape. The growing risk of cold infections is a major threat not only to the health systems but also to the patients' lives. Although there is still not enough published statistical data, significant number of patients hospitalized with COVID-19 have been found to develop secondary systemic mycosis, otherwise known as fungal infections, that lead to serious complications and even death. A study shows that 25 out of 528 patients who had mycosis, of these patients, 12 survived while 13 died. This episode on the physicians, we will be discussing the major aim to alert the population about the high risk of associated systemic mycosis in COVID-19 survivors. Welcome. If you are just joining us, this is your regular health TV talk show, The Physicians, where your health is our business. My name remains Dr. Memuna Yusuf Kadri, and of course, I'm usually not on this show without my lovely co-host.
My name is Dr. Martina Agbere. Welcome to the program, The Physicians, where your health is our business.
Today we are talking about a very important topic, COVID-19 and mycosis.
I'm actually very interested.
Very, as a survivor.
Yes, as a survivor, as a coronavirus survivor, I'm very interested. I need to know the link, the relationship between COVID-19 and mycosis, also known as fungal infection.
I'm much more interested, not because of just COVID-19, but for the fact that this was one of my theses, the correlation between skin diseases and mental illnesses. And I know I had loads of fun during that, time I did my sample collection from 400 participants in the skin clinic. Yes, in the skin clinic for almost 9 months. When people come in for skin-related problems, they are actually having, some form of underlying mental related issues.
During dermatology posting when I was still in medical school, got to know that most of the diseases that people manifest with, you actually have the skin.
Because the skin is the biggest organ in the body.
Presentation. Yeah. So when you see this on the skin, you are able to now link it to a particular health disease condition that the person has.
Yes, like a mole now.
Exactly.
It can show that there's something actually going on inside the body.
Absolutely,
that's just showing like a drop.
Yeah.
That's why an expert is coming on board. What is that relationship? You that have had COVID and now you're having a fungal infection, especially black fungus. Why is that coming up on board now? Is it that you have an underlying disease, or there is something else that we need to look into? Of course, an expert is coming on board. I'm sure she's going to do justice to this topic.
I can't wait to engage her because I have a lot of questions.
So waiting for that. Yeah, because you need to also know your chances.
I need to know, you understand.
Don't worry, we'll be right back after this short break. Welcome back. If you are just joining us, of course, this is your favorite health TV talk show, The Physicians, where your health is our business. On today's show, we're talking about a very important topic that concerns you directly or indirectly, because we are still within the COVID-19 global pandemic. And our topic today is mycosis, otherwise known as fungal infection to you, and COVID-19. And we have no other person in this room, an amazing, beautiful sister, colleague of hers, Dr. Rita Oladele. She is a senior lecturer at the College of Medicine, University of Lagos, and a consultant clinical microbiologist. Dr. Oladele, you're welcome.
Thank you so much.
You look fabulous.
I'm trying to look like you, I guess.
You're looking really, really nice. Welcome to our program.
Thank you.
So, Dr. Oladele, you're welcome once again. You know, I will use some not too big technical word, mycosis, but we've tried to explain that it's also known as fungal infection. But we want to know, okay, what are these things? What is mycosis? What is this fungal infection?
I think that's a little dangerous step you took because it's a topic I'm pretty passionate about, and I tend to believe I'm an authority on the issue, right? So fungal infections. So fungal infections are caused by fungus, and I tell people that I'm a fun girl.
Wow.
Yeah. So this fungus, they're in the environment. Most of them are in the environment, right? Although some of them live on us, on our skin, in our GIT tract. Okay, for females, they carry, some of them get colonized. In fact, about 50% of women at one point or the other have had vaginal candida infection, vulvovaginal candidiasis. Nothing life-threatening. And then the fungus is in the environment. So I would list one that you know and you like. Mushrooms, they're fungus, yeah. And they're really nice, yes, yeah.
People love to eat that.
Yeah, I love mushrooms. And then you have, you eat bread, right?
Exactly.
The yeast that you use for your bread, yes. So they're pretty very, very common and useful in life. The first antibiotic in the world was from a fungus, yeah. So we're fungals, it's beautiful. However, there are about 300 to 500 species of it that tend to infect man. And so they cause infections in man, and these infections range from superficial infections. I heard you talking about skin, right? Yes. So skin infections, not life-threatening, but, affects the morale, affects, especially in children, can affect going to school and all that. And it's cosmetic. It's a cosmetic problem. Some of them can get severe enough to have super infection with bacteria that will predispose to something else. But generally, superficial infections, they're okay. Even for the young children, we always tell them, you will outgrow it because there seem to be some hormonal tie to it. Then you now progress from there. You have the subcutaneous infection. I'm sure you probably would have seen some farmer or something with some massive leg,
yes,
okay, yeah. And you see water and fluid draining out of it. So we call that mycetoma, and it's caused by fungus. It's in the environment, in the soil, and so that one could progress because it's a chronic infection, and with time it could lead to amputation if it affects bone.
Wow.
So that's that. Then we have the systemic mycosis. Nigeria is endemic for histoplasmosis. That's the most common systemic mycosis in our environment here. Right. So there is this other group called, they call opportunistic infections. Okay. So they need people that their immune system have been suppressed. Maybe people with diabetes that is not controlled, people with HIV in the advanced HIV disease stage, people that are undergoing cancer therapy, right? So they take chemotherapy or transplant patients, anything that brings the immune system that predisposes them. Also, even patients that are in the hospital and have been there for a long time.
Nosocomial?
Yes, so you could have candida because the patients have had long time use of broad spectrum antibiotics, and because candida is part of the gut flora, the normal flora you know, normal resident of the body. When I teach my students, I always use this, and I hope you can permit me. I use this analogy. I say, do you know the Agberos? Aha! So you have this group, and funny enough, in the Agbero kingdom, in quotes, there's hierarchy.
Yeah.
So you have the chairman, you have the other people, you have the bus conductor. So you can imagine in a case where somebody comes and wipes out the chairman, and maybe they were fighting and chairman is taken out and the other people are taken out, and then you're just left to the bus conductor or the ones that collect money on the road. It becomes a problem because they're unruly. They've never had leadership position. So they now find this opportunity of being leaders and they go haywire. So that's what Candida does. You give broad spectrum antibiotic, you wipe out the normal flora, the anaerobes and the other bacteria that control it and say, hey, yeah, little boy, take it, slow down. And then all of a sudden, Candida is king. And it goes, and it's so bad that science has shown that for every day you delay starting treatment for a patient with invasive candidiasis, you increase the risk of that patient dying by 20%.
Seriously?
Yes.
So Candida shouldn't be something, you know, because a lot of times you find out that, you know, in secondary school, toilet usage, all those things people will be talking about. Is it not just Candida?
Yes, no, but that's fine when it's causing mucocutaneous infection. It's not life-threatening. But once it crosses into the bloodstream and disseminates, it becomes life-threatening. 20%. Every day you delay starting treatment.
So treatment must be timely and immediate.
Before you even get to treatment, you must know that
there must be that index of suspicion on part of it. So somebody must be looking for it.
Now we're talking about mycosis. What is the correlation between COVID-19 and mycosis?
Beautiful. So the issue with COVID-19 is the impact that it has on the body system itself, and it's something we don't fully understand. So the full correlations are still studies ongoing, but we believe that the COVID-19 does affect the lung parenchyma that is making them predisposed to this infection. In India presently, as of yesterday, they had reported 28,532 cases of the black fungus, mucormycosis.
Wow.
Yes.
These are really interesting times, and of course we know what hit India. But now we are talking about mycosis or fungal infection. Definitely our viewers want to know, how can they know that this is it? Because even if you don't go to the clinic, you know, immediately, or you don't know you have to go to the clinic, what are those things, like the signs, the symptoms, that would tell me, I think I need to hit the clinic and get better clarity and the right diagnosis before something else happens
in the first place?
So like I said, the organism is in the environment. So let me tell you, have you seen a refuge dump before? You must have seen a refuge dump. Yes. And then sometimes you see this black thing covering it, you know, decaying material. So fungus thrives on decaying dead materials. So they need those decayed materials. So sometimes you must have seen your bread that you kept away.
Yes,
and then you have black. Yes. So that's a fungus. And so it's in the environment. Sometimes for you to have a fungal infection, there are two things that must take place. It's either the individual's immune system is suppressed, or the burden of the spore is so high that it can even overcome the immune system.
Dr. Oladele, let's hold it there. Now we know two things must happen before a fungal infection will occur. We are going out to the street, we're keeping up with the physicians as it is right now. We'll be right back after this time out.
It's a very, very serious pandemic that affects so many things, so many people.
It's real. I've been protecting this disease by using nose mask.
No. I'm a bit scared because of what people have been saying concerning it, that it has adverse effects.
Not at all.
I've not taken my COVID-19 vaccine.
I know. So that is why I'm always careful. I wash my hands regularly. I use my nose mask. and I use my hand sanitizer?
Yes, it's a plus.
Yes, someone that has it can easily die young because it attacks someone that has ailments or different kind of diseases.
I guess you must have enjoyed keeping up with the physicians, just the way we here in the studio always enjoy your comments, your reaction, and of course, you know, the giving back this is very important as it is, because we know information is key and health is wealth. And on your regular TV talk show, The Physicians, your health is our business. Before we went on break, Dr. Oladele, we're talking about, you know, 2 things that must happen before a fungal infection. I like the description you gave about bread, because that bread thing is very common, but I don't know in COVID, that before we're not living bread, it's good for us to hear further details on these 2 things that must happen.
Okay, so like I've told you about immunosuppression or the burden of the spore, we also need, so you also know that there are a group that more at risk of these infections. Yeah. Like I talked about, the black fungus is more common in uncontrolled diabetics. And you can also know that COVID-19 has very bad outcome in that group of patients too. Now, the other thing is also people that have existing lung conditions before. You know, the COVID-19 doesn't knock on the door and say, do you have this? Or don't you? Okay, so I can leave you and move to the next person. Yeah. So because of that, there's need for us to have that high index of suspicion to ask the pertinent questions as clinicians. Even if your doctor does not ask you that question, you should volunteer that information and said, oh, I've been treated for TB before, or I was being managed for this, or I'm on steroids. Okay, because these are the group of people that are at risk of fungal infections, especially the lung infections. Okay, so once you know your risks, I mean, you assess your level of risk, and then you start having, maybe you're having chest symptoms. It's not something that you should just take cough mixture and stay at home, because you know that your underlying problem. You should go to see the doctor. So for the skin infections, yes, I mean, see your dermatologist. It's not life-threatening. It's not something that should give you anxiety attacks. But if you start having cough, or you have this persistent headache, or you notice any unusual coloring in your skin. I had a patient once, a very interesting patient. He was an uncontrolled diabetic, was in church and collapsed. So they rushed him to a clinic, and there they said his blood pressure was up. And he forgot to tell them there was diabetic. He had defaulted treatment for over 8 years. Well, to cut a long story short, after they have managed him for about a month plus and he just wasn't getting better, he had this persistent headache. I was called to come and see this patient. He was in a private hospital. As I walked in, the first thing I noticed about the patient was a black patch on the face here. And I was like, what is this? He said, that one started sometime, so about 3 months now it has been there, but that's not where the problem is. Yes, the problem was that his eye was getting swollen, was protruding, you know. If you notice that protrusion, so that was what's important. I told the doctor, I said, I want a touch. I want to look inside his mouth. He said, no, that's not what we called you for. We want you to tell us which drug to give him.
So?
Yes, that's yes. I'm a clinical microbiologist, so I deal with antibiotics, so that's what they wanted. But we insisted, and I using my phone over and just opened the palate, I noticed that black patch. You know why the black patch was so, they were putting anointing oil on it, so it was shining and looking at me.
Wow.
So when I opened the mouth, the whole upper palate was all black. That's the black fungus.
Wow. And he didn't notice that he had something in there?
No, he was in pains. He had severe headache for 1 month. That was not relenting. And then he started having proptosis. And luckily for him, the ophthalmologist that saw him said, I think this is infective, okay, in looking in. And I think we should call Dr. Oladele. Well, to cut a long story short, we eventually lost him because we took him to theater. And by the time you're taking out the dead tissue, all this eye, everything popped out. But it was something that could have been prevented if it was caught early enough. The patch was just going, that black patch was just going bigger and bigger. And we're using anointing oil to treat it.
So how do you usually make the diagnosis of mycosis, of fungal infections?
So one of the challenges also is that the presentation there's nothing typical about it. It's like your normal infection coming up, but there's more to it. So you need to know those that are at risk of fungal infections, the risk factors. You also need to have a detailed history of where do you stay, what environment do you live in, do you have mold, do you have damp in your house?
Yeah.
That's clinic history taking that will seem to,
yeah.
we need to get that. And then the clinician must have that index of suspicion. If it is not there, you will not ask for the right test. And then unfortunately, because there's this gap in knowledge, the tests, most of them are not available in Nigeria. If we have this test available, okay, and then there's that index of suspicion, and we make provisions for training, capacity building, we will diagnose these infections faster, and we will deal with them faster. One of the reasons why India is reporting that is because in India they have 3 mycology reference labs. They have people that are specialists in the field. Okay, so there's that index of suspicion because you are specialists in the field. They teach the students graduate to be doctors, and they are looking out for this. So you will find it. You only find what you are looking for. You don't find what you are looking for.
Why don't we have that in Nigeria? We don't have any of such labs?
So one of the challenges is that, I mean, we went to medical school in Nigeria here, right?
Yeah.
And if we are sincere to ourselves, who taught us? So we need to relook at our medical curriculum.
So from what you are saying now is that it's possible for us to easily miss a diagnosis of.
Oh, it happens every day.
Wow.
It happens every day.
High index of suspicion.
Suspicion is
That
critical.
Yes,
Yes.
very, very critical.
Because it does not, I mean, you can tell a diabetic, right? You say,
Yes.
oh, if you start weeing so often, and then, you can tell a diabetic. Unfortunately, for infections, they don't hold a signboard. You've got to go search for them.
It's actually unfortunate that I feel so bad because some of this is actually preventable.
Yes.
Maybe if we can't have a pandemic again, do you understand?
Yeah.
Imagine if not for pandemic, we would have had all these isolation centers and things people like put together.
Yeah.
It's only in crisis time that we're able to do some things. But this is actually, we said 20%.
Yes,
more. You understand? So,
Deaths than
yes.
before.
So I think something needs to be done.
Yeah.
But the fact that we're not seeing it does not mean that it's not there.
Yeah.
And it's not happening.
And it's not happening.
In fact, at this point in time, I want to say thank you very much. You've really, you've shown the touch on this very important topic. And for those of us that are COVID-19 survivors, now we need to understand that there are other things that are ongoing, long-standing, complications that may arise. So please ensure that right now, as we are still in this COVID-19 global pandemic, take charge, because you understand, on our regular TV talk show, your health, of course, is our business.
Thank you very much, Dr. Oladele, for coming on our program. And you actually have opened our eyes to a lot of things that you talked about, especially with reference to the fact that even making diagnosis is a bit difficult. I think prevention is always better than cure. Knowing that making diagnosis is difficult, it just means that people have to be more careful. Not about the one that is on the superficial one, but the one that is that becomes invasive. So with that, we'll also talk about invasive fungal infections very soon, because you talked about the guy that died because it actually went to the brain. So that is actually very important. We need to deep dive more into that. Well, as we've all heard what my co-hosts also talked about, let us take things more seriously. If you do your own path and I do my own path, I think we'll get better in this country. Don't forget to follow us on our social media handles. We're on YouTube, on Facebook, on Instagram. And if you want to be part of this program, you're just a click away. You can send us email. And of course, we'll invite you to be part of our program. Anytime tea, we're always there for you, because your health is our business. I am Dr. Martina Agbemi. Have a blessed day.
And I remain Dr. Memuna Yusuf Kadri. Till next time, stay blessed.
I am Dr. Akpojeme Afiemo. I'm a consultant pediatrician and I work in the respiratory allergy unit of the pediatric department in LUTH. Keep watching The Physicians.
We're not just talking about breastfeeding sometimes. We're talking about the ability of a woman to breastfeed exclusively for the first 6 months of life.